Welcome everybody to the Society's webinar this evening. This is about shaping the future of wound care. Thank you so much for taking time out of your evenings to join us. I know this is going to be a fantastic webinar. I'm Sarah Gardner. I'm Vice Chair of the Society and also its Education Programme Facilitator, and I'll be moderating this evening's session. So before we go on, I just need to say that the Society of Tissue Viability acknowledges that there are other healthcare professionals, such as podiatrists or allied health professionals, and obviously our clinical support staff that are very much involved in wound care. And although tonight is focusing on nursing careers in tissue viability. Obviously, we want to acknowledge that it is a multidisciplinary approach, and that anybody with an interest in wound care is very welcome here this evening. And we also would welcome your thoughts, your comments, your questions as well. I'm not sure about you, but I've been hearing conversations recently or over the last year from various parts of the UK about, what is the state of tissue viability? Concerns that as a speciality, where are we going? We hear about posts being frozen. We hear about lack of investment in the services. We hear about when maybe people have got to a senior position within tissue viability that when they leave, their posts aren't replaced sort of like for like. And although that's really important, we can't ignore that if that is happening, and maybe there's some work that needs to be done around some analysis on that. We don't want it to be doom and gloom this evening. This evening is all about celebrating roles in tissue viability and helping you think about a career pathway. So some of you out there could be generalist nurses with an interest in wound care, and you're just wondering, when you meet tissue viability nurses, when you work with them, I'd like to be in that job, but how do I get there? It could be that you have an interest in education, but again, what are the barriers? How do you get there? Am I able to do it? And what about research? It all seems a bit scary often to people, doesn't it? But hopefully after tonight's webinar, you'll know a lot more about it, and our fantastic speakers will be guiding you. And tissue viability isn't just about the clinical input, is it? It's not sort of hands-on. It's more than that. Certainly when you lead a team, it's about that leadership. It's about becoming a bit business savvy, isn't it? Knowing the numbers, how to put business cases forward, how to procure, how to manage people, and also systems, and how we have a voice. It's really important if we're to keep tissue viability on the radar, as it were. We need people with these skills and this knowledge. So we've got the perfect speakers who are going to talk to us about that. So as I said, we've got these 4 speakers, and they've all taken a slightly different career pathway. We have Luxmi Doonmoon, who is a nurse consultant in tissue viability within London Northwest University NHS Trust. We have Madeline Flanagan, Principal Lecturer and Programme Lead for MSc Clinical Dermatology and Skin Integrity, who's from the University of Hertfordshire. We have Paul Hardy, who is a lead tissue viability specialist and an associate lecturer from Derby, from University Hospitals of Derby. And we have Claire Greenwood, who is a clinical nurse specialist in tissue viability, but also a visiting research fellow. And that's at Leeds Teaching Hospital, and also the Clinical Trials and Research Unit in Leeds. So what the plan is this evening is each of our 4 speakers are going to talk to you. They're going to tell you their story, their journey, as what took them in that direction. So it's a very personal story of how they got there. And after each of our speakers has presented their story, we'll have plenty of opportunity for discussion and for questions. So as we go along, if you want to post a question into the Q&A or into the chat box, I'll just keep an eye on those and I'll put those to the panel afterwards. So some questions will be quite collective, so I will pick a speaker, but I do hope this to be informal. It's, not death by PowerPoint. You're not getting that this evening. It's seeing people's faces and hearing their stories. So please do contribute to that conversation. It's given me an opportunity, really, while we've been planning this webinar, just to reflect on my own story and why I went down the tissue viability route. So before we have our speakers, just tell you a couple of things about why I went into this sort of speciality. Right back 100 years ago, 45 actually, when I first started nursing, I worked, I think it was my first ward, and I came across, there was a patient on that ward. She was a farmer's wife and she had bilateral leg ulcers, and I'd never seen anything like that before. And I was absolutely horrified. And I can still now, all these years later, I can still see her name was Dorothy, and it was a Nightingale ward, and she was on the left, and she was in bed on bed rest, which you could argue is maybe a good thing sometimes for venous leg ulcers. But the pain this woman was in was just phenomenal amount of pain. And I remember even that early part of my career thinking, this is not right. It was some years later, it was mainly I went into district nursing, and that's where it really steps up, doesn't it? Often in district nursing world, you're exposed to a lot of wounds, and that's when my sort of passion for the subject really sort of upped the game, really. And I started obviously reading more, attending study days, and took a real interest, and I sort of led on that within my district nursing team. Within that career of district nursing, I was very sort of lucky and privileged to be able to sort of develop my career. So I was the team leader initially, and then I became a community practice teacher. So that's when I really took an interest in education and used to contribute a lot to education around wound care. And then I became a locality lead. So that steps up in terms of your leadership. And then you can start to influence quality improvement in care. And even though that was quite general, because I was in district nursing, I still had that passion for wound care. Lucky for me, well, at that time, tissue viability role, it was only starting to evolve. And it was some time before the trust, well, it wasn't a trust then. I can't even remember what it was. It was so long ago. It was quite a while before they did invest in a tissue viability nurse. But there was no leadership. It was like someone who had maybe an interest in wounds. And at that point, the sort of level of banding that was put into the team was lower than I was working at. So, that wasn't attractive to me. But I was fortunate that we ran an equipment service like pressure relieving equipment, etc. And the spend had gone off the scale. So they put me in as a secondment to say, Sarah, go and sort that spend out. We need to bring it down. Lucky I was able to do that. So they thought, wow, she's all right. So they then asked me if I wanted to stay. So I stayed in the team. And the rest is history, really, just through leadership, through, a strategy. I built business cases to build on the team, to get the skill mix in for more administration, etc., more clinical roles. And then the team built over the years. So, that's what I did. I led the community team, and it was a fantastic part of my career. I absolutely loved it. But all good things must come to an end, and I decided to retire from the NHS nearly 6 years ago. But the skills that I had and the knowledge that I had, and also I must mention the Society of Tissue Viability here being a big part of their community, gave me the confidence that once I retired and moved to Cumbria, that I then set up my own business. And I'm still in the tissue viability world as an independent tissue viability consultant. And I still work really closely with the NHS and primary care on quality improvement initiatives and education. So that's my sort of story in a nutshell. Yes, some of you might resonate with that, but as I said, you're going to hear 4 other stories as well. So before we start, we hear from our speakers. There's just one question on a poll that we just want to ask you here this evening. So Kerry, would you mind just launching that now, please?
Well, it's a Slido poll, so if everybody could get their smartphones ready and just scan the QR code, you don't need to download anything. And you can just answer the question. Should, with luck, see the results pop up on screen.
That's great. So are you currently considering a new role or a change? Wow. Wow. Okay. That's fantastic. Okay. Thank you for that.
No problem. Oh, we're getting some
Oh,
more.
I'm getting some more. I thought it was too good to be true. Okay. It says I'll give it some time.
Yeah. Okay, just give it a couple of seconds.
Still good figures. Yeah. Okay.
Yeah, amazing.
And the no's might be that people are already, in a role in tissue viability and they're happy where they are, but we don't know any of the detail of that. But yeah, thanks for sharing it. That's really interesting. Okay. Right then, we're now going to move on with our first speaker, Luxmi, nurse consultant, and Luxmi, we'd love to hear your story. So over to you. Thank you.
Thank you so much, Sarah. And I think that poll takes me well on where I wanted to share my journey. So good evening, everyone. And it's a delight to be here with you all today. So as Sarah said, I'm a tissue viability nurse consultant. My name is Luxmi Dunmoon, and I have both community and acute experience. But that journey, what shapes the way I work and teach and support my team, I really want to share that with you because as I saw in the comments, some of you really want to know how to get there. Rest assured, my first formal step into the specialized world was not a consultant job or a senior title. I was a link nurse on the ward and alongside colleagues day to day seeing where patients were at risk and where staff needed some practical support. We did small changes that could prevent harm. And that role itself put me in a unique position. It was close enough to day-to-day challenges to understand them deeply, but also taking a step back enough to ask, how can I do this better? So from quite early on, I made a conscious decision to seek out learning. Anything that was available in the form of courses, study days, workshops, online e-learning, anything that would help me turn those real world challenges into evidence practice, I was grabbing them. Pressure ulcer prevention was basically my passion. And then I fell in love with leg ulcer. But then I realized there's more to that. And it's just the basic wound assessment in itself. So the dressing, there were so many, and I wanted to learn about all of them. And then I realized how closely we work with multidisciplinary teams such as plastics, vascular, podiatry, and each learning opportunity gave me more knowledge. It gave me tools basically to teach, to coach, and to translate evidence into something usable on a busy ward. That pattern continued, and every study day, every course, every conversation I've had with mentors or peers didn't just add to my CV. It shaped how I assess risk, how I explain complex ideas clearly, and how I supported staff confidence when caring for patients with wounds. I learned to listen, and really for me, this was a new thing, to really listen, understand what really needed to be changed, and then help teams act in ways that were practical, sustainable, and well patient-centered. But as I move into my specialist practice, and I am so ever grateful for my first line manager who remains my current role model as we speak, and eventually to the current consultant level I am, those early experiences have stayed central. The role of a tissue viability nurse, from my point of view, whatever the exact job title you have or setting you work, is often described as providing the expert advice in wound prevention and treatment. And doing so, strong communication with other nurses, multidisciplinary team, and patients have become my first strength. I've been able to optimize on my weak point, which was communication, and I've made that my strength. And this is a core element of the tissue viability role, if you think about it that way. For me, that rings true. It's not only the clinical knowledge, it's about helping others understand, applying that knowledge, and keeping the patient needs at the center. Today, even as a consultant, my work includes advising on complex cases, guiding prevention, designing education, supporting staff, but 50% of my role remains patient care, because I think this is what shaped me as a TVN. It's still rooted in the same professional curiosity. I've still got the same collaborative spirit. I'm still learning every day. It's the same as when I was a leg nurse. It's really noticing a gap and thinking, how can I close it? Seek the best evidence and work with teams to make that change happen. So whether it was a quick check-in with a ward team or a longer discussion with community colleagues or presentation like today, the aim for me was better outcome for my patients. So more confident clinicians, more confident colleagues, and capability for caring for people that we look after. So as we move into our session, I brought the practical and hands-on perspective of someone who started at the bedside and the broader view of someone who spent years helping system teamwork, working across ICBs more effectively across all aspects of wound. And anybody, and I mean it, it doesn't matter who you are and where you work, if you think tissue viability is a place where you want to be, just reach out. There are so many people who are willing to be mentors, and there are good mentors out there. I tried it and I don't regret it. So if you're in a similar situation, please do reach out. There will be a helping hand somewhere out there, and the Society of Tissue Viability will definitely support you in there. So I really look forward to have many more colleagues like myself in the tissue viability world, and look forward to catching up more in the session as well. Thank you, Sarah.
Thanks, Luxmi. That's great. Okay, so now we're going to move on to Madeline, who's gone down the educator route. So please, Madeline, tell us your story.
Okay, thank you for that, Sarah and Luxmi. And I think, you know, the overarching theme is about taking opportunities. And when I reflect on my career, you know, most things happen by accident. And I think that's probably the same for many of us. So as a student nurse, I broke my arm and I got seconded into a dermatology inpatient ward in those days. And all the patients on that ward were leg ulcer patients. So my experience is very similar to Sarah's, that this made chronic wounds, made a massive impact on me early on in my career. But there was no speciality focus, there were no conferences, there were no interest groups, there were no books, no journals, nothing, no interest in wound care at all. So I couldn't really do much about it. So when I was a surgical charge nurse in charge of a male surgical unit, I remember Granuflex was launched. This was probably about 1984, 1985. And this really revolutionized sort of interest in dressings, because until then, most of the dressings Florence Nightingale would have recognized. So we suddenly had these new plastic type materials and nobody knew how to use them. All I did was read the leaflet in the box. That's literally all I did. And before I knew it, I was being pulled all across the hospital to give advice about wound care. And when I think about it, the only advice I could give was either put Granuflex on it, Opsite, or gauze. That was the extent of my advice. But I became useful to particularly the other surgeons, and they would call me in to look at their wounds. And it's interesting, about this time, the Society of Tissue Viability, I think, coined the phrase tissue viability in terms of the speciality. And we started to adopt it in my hospital. The consultants thought it was really funny, and they used to call me Patricia Viability. They used to ring up and say, "Can Patricia come down and see this particular patient?" So at that time, it was not a speciality and it wasn't taken seriously. But like Luxmi and Sarah have said, I made myself useful. I started looking at mattresses. I started creating a fuss about pressure damage and the wrong use of dressings. And at this point, nobody was doing that. And how I got into education, so I was informally acting as what we would call a TVN, but I wasn't being paid for that. And in fact, half of my time I probably was actually on other wards advising other people about their wound management. The rest of the time I was running my ward. But I got invited to an education meeting where the director of nurse education happened to sit next to me. And in that meeting, I was quite vocal about something or other, probably mattresses, I suspect at the time. And at the end of the meeting, he called me over and said, "You wouldn't be interested in a clinical teaching job, would you?" And we had a little chat about it. And he said, "But you would need a degree to do that." And I said, "Well, I've got a degree in nursing." And he said, "Oh, okay. Come to my office tomorrow." And that, as far as I remember, I virtually went in a few days' time to his office. He offered me a job as a clinical teacher. What I didn't know is he had an area of really bad practice in the care of the elderly ward, and he needed that sorting out. So I took that on. Practice was absolutely dreadful. The staff had been there, they were twice my age. They were suspicious about new ideas, research and education, and it was a really difficult job. But basically I pushed and I pushed and I pushed, and we improved things gradually. And so my introduction to education was literally in clinical practice, the sort of role that you would incorporate now within your TVN role. But at that time, nurse education was just coming into universities, and degrees were going to be the standard route for nurses to qualify. So that was about 1995. And at that point, my local university offered me a role as a nurse educator. And I can remember feeling a complete fraud, really nervous about it. But I was young. I thought, you know what? What's the worst thing that can happen? I can go back to clinical practice if I don't like it. And for about 5 years, I did a half clinical role and a half education role. In the end, I established the first BSc, as it was then, in wound management. That became an advanced practice degree about 5 years later. And really, I've been running programs at the University of Hertfordshire since then. So I was a single one-man band, if you like, getting clinical colleagues to come in and teach on my programs. And over the years, I have managed to be able to build up a team of 10. We run dermatology degrees, we run skin lesions degrees, and we run skin integrity and wound management master's degrees. And I would say now probably have trained 40 to 50% of tissue viability nurses in the country, including, many people who may be here in the audience or trustees. And that's been an absolute privilege. And for me, academia it's given me a platform to extend my clinical skills. And I still consider myself as a clinician rather than an educator. It's interesting how we get pigeonholed. I'm a clinician working in educational sort of sphere, but I'm having a much bigger impact than I could have had as an individual tissue viability nurse. So I'm sort of shaping practice, and that gives me a real buzz. And I've been doing that actually now as an educationalist for over 25 years. But there's a massive overlap, and I'll talk about that perhaps later, a massive overlap between the skills of being a tissue viability nurse and a clinical nurse educator. There's a real overlap, and education needs your skills, it needs your enthusiasm, and it's really part of that career escalator, going from clinical practice into education or research. And you can keep all of those plates spinning at the same time. So there's huge opportunities, there really are. And I just say, go for it. Okay, I'll stop now and we'll hand over to the next person.
Okay.
Thank you.
Thanks, Madeline. Really interesting. Okay, Paul, and Paul's here as a lead tissue viability nurse specialist. So Paul, what's your story?
Well, not as exciting as those two, that's for sure. Good evening, everybody, and thanks to the Society of Tissue Viability for inviting me to speak tonight. Wow, looking back, it's been a long old road to get to where I am now, but it all started back in '98 when I first qualified as a nurse, and I didn't stay where I trained. I moved away from where I did my initial nurse training and went to work in a big city. I went to work in London, and I found myself working in a lot of different areas, so places like orthopaedics, emergency medicine, critical care. And then I moved away from London. I was working in Norwich for a little while, again in emergency medicine. And then I moved away from Norwich and I came back to Derby, where I'm from, and I am at the moment. And I found that I really had a bit of a passion for education. So I took on a role as a clinical educator at the hospital I'm working in currently. And I did that for a good few years, excuse me. But then my job got put at risk. It was a bit of a scary time at that time. I remember it quite well back in 2011. And being a person at risk, we had the ability to look at an at-risk register of jobs that were available to those individuals who were at risk at that time. And one of the jobs that was actually on there was a tissue viability job. I hadn't really thought much about wound care or tissue viability prior to that point, really. And perhaps my biggest motivator for perhaps eventually interviewing for the role and being successful was the hours, to be honest, because I was working 9 to 5 as an educator, and I had young kids at the time, and it was that attraction that kind of pulled me into that. And so I applied. I had to have an interview because of somebody else's interest. I was successful, got the job, and in 2012 I was successful to start my tissue viability journey then in 2012. And actually, in joining the team, it was that kind of education basis where it come from that really did help support and build the team at that time. They were quite a young, well, not a young team, but there was only a couple in the team. We hadn't really thought about delivering education, things like that at that time. And I was able to come in and kind of, steer us in a direction towards, starting to deliver training on pressure loss prevention, wound management, and things like that. But that was back in 2012, and then in 2019, when our organisations merged, so Derby merged with Burton Hospitals, I took on a lead position. So since 2019, I've been the clinical lead for our tissue viability team, and that just brought with it a whole new raft of issues, really, because I found myself being responsible for a team, a small team at that time. So not only did I have to, act clinically, but I was also responsible for leading and managing that team as well, and supporting them on their journeys as well, to achieve all they could be as tissue viability nurses. But it's perhaps something when I look back and my passion for education, I never actually thought I'd end up being a tissue viability nurse. I always thought back when I was a young staff nurse just qualifying, I always fancied being Charlie Fairhead at a casualty. And I didn't realise that, years later I'd be, thinking to myself, I'm someone who's got fingers who probably got PTSD from all the places they've been over the years. And I'm very lucky to be where I am. But it is difficult. It's not easy, and it does take a lot of hard work, especially when you end up managing not just colleagues, but they become your friends in small teams as well. And that's something when you are becoming to a lead position, managing people is part of the job, and that leadership, as Sarah spoke about earlier, you do find yourself kind of becoming proficient in a lot of other skills that you perhaps thought that as a nurse. So skills in things like patient safety, governance, and investigations and things like that. So I'm privileged to be where I am. But so what else was I going to say? I was going to say that So I think that's it really in a nutshell. Really, that was a bit quick and a bit short there, really. But yes, I think it's not as exciting my journey as the other ones. But yes, I think that's all I've got to say, really. So yes.
Don't you be saying it's not as exciting, because it's just that it's different, isn't it?
Different.
Everyone's story is different.
I think that it is. And so you don't think you look back on your career and you think, where have I been and where am I going to? And I never thought 13 years later I'd still be doing this job. But you are in a unique position as a tissue viability nurse. I think we are holistic practitioners. We're not just focusing on that hole in the patient, we're looking at the whole of the patient. And I think when I go down to review a patient, you find yourself facilitating a lot of things. You know, we've got no egos or no reputation to protect. We find ourselves bringing in other people like dermatology, like vascular services, orthopedics, and things like that. And I think as a TVN, you're in a unique position to kind of facilitate all that. So I think if you want to consider the patient and look after them as a whole, you know, using people like pain teams and things like that, then I think, you know, tissue viability is kind of that a unique speciality in that sense, I think, definitely. And I think, you know, I'm very fortunate to be where I am. I work with a great team, but, you know, that's not to say it's not got problems and issues. I mean, the NHS is full of problems and issues. And I think, you know, pressure prevention and, you know, things like that, it is really difficult. But, you know, I still turn up every day and I'm still doing it. So something to be said for that, I think.
Thanks, Paul. That's really great. Thank you so much. Okay, and then finally, Claire. And Claire is sort of a joint role, clinical, but also as a fellow, as a researcher. So please tell us your story, Claire.
Yeah, so I think my story is probably fairly similar to a lot of the people here. That, you know, I never started out with you know, when I grow up, I want to be a tissue viability nurse kind of thing. You know, it's just sometimes these paths just happen. So I did I didn't do my nurse training straight away. I went to university and I did a degree in medical sciences. You know, I've always liked sciencey bits, you know, I've been a bit of a nerd. But actually at the end of that, I kind of came out of it and I was like, I don't really know what I want to do. I worked in an office for a year and I didn't like it. So I just thought I'll do my nurse training and I could do a postgraduate certificate in nursing, which meant that I didn't have to go and do a full degree again. I could do it in 2 years. So I did that. And then, you know, I think like everyone, you see a lot, you do a lot of different placements. And I really enjoyed, I didn't go into the community, but I really enjoyed my district nurse placement. And I remember, again, that one patient that always sticks with you, that, you know, there was this gentleman who was, he had MS and he was a retired vicar. And I just remember him having this most horrendous category 4 pressure ulcers. You know, they were down to the bone, and it was just like, you know, him and his wife living at home together, and, you know, and those kind of things, it just really gets you thinking right from that start of like, you know, is this the best thing that we can be doing for this patient? He had a special mattress, and, you know, and the district nurses were going in every day to dress them, but, you know, there wasn't an awful lot there going on. But anyway, when I finished my nursing training, my first job I got was in surgery. I was a colorectal surgery ward, and you know, and a lot of that, you know, actually part of that, I really enjoyed looking at surgical wounds. It was quite a complex centre. You know, we got a lot of complex patients coming from all over the region, you know, for advanced colorectal cancers, and, you know, because of the type of the surgery that they were having, they would often have high risk of wound breakdown, and I got really interested in, you know, how we were managing surgical wound dehiscences as a staff nurse. And at that time we were just introducing negative pressure into the trust, and because it was fairly new, there was a dedicated negative pressure nurse specialist in our organisation, and I got chatting with her, and, you know, and then it just turned out that she was going on sabbatical for a year. She was going travelling, and she said, you should apply for this job. And so I thought, yeah, that sounds really interesting, you know, the idea of just going around and doing nothing but negative pressure dressings all day long, you know, which was what pretty much she did, and doing that training and education. So I went for that job, and it was just as a secondment at the beginning. And, you know, and I did it, and I absolutely loved it. And then it just happened after that year that a job came up in the tissue viability department. You know, we sat within tissue viability, but I just saw generally surgical wounds, negative pressure wounds, and did the training. And a lot of it I was keeping tabs on where all the pumps were, because they were going missing all the time. And a general, a tissue viability role came up that was potentially going to be made substantive. And, it was like, well, actually, yeah, I want to learn about all the other types of wounds as well. I know a lot about surgical wounds, but I don't know an awful lot about pressure ulcers or leg ulcers and all those wounds. So that's where I went from there. And I think like what Luxmi was saying, my line manager, she was my mentor. She still is now, even though she retired. She really influenced a lot of what I did. And, I wouldn't be where I am today without her. And she was really into research, and she had been doing her PhD at the time when I first started. And I'd never considered research before, but I was seeing what she was doing and the research she was doing, and I was fascinated by it. And then it was just one of those that she suggested, I think you should do this. And I was like, all right then, not really massive thoughts about it. I never really had much experience in research or, just from what she had been doing. And so, I started doing my PhD back in 2012, and I did it part-time whilst working clinically. So I did, half time working doing my PhD, which usually takes 5 years to do a part-time PhD. I had 2 periods of maternity leave whilst doing it, and then I submitted at the beginning of COVID. So, it took me 8 years to do my PhD in the end, but I did it and I got there in the end. And then, it's been just one of those things where, I love that. I love doing research. I love trying. I'm a clinically curious person. I'm always the annoying person that's there going, why are we doing that? Why? And so it suits me great. But, I could go into the full-time academic world. But for me, a lot of these questions that I get, it's from the patients and from working clinically and working with staff. And, I think you see a lot of work with the academics, and they're like, I've seen this really good device. It looks brilliant. And I'm like, yeah, that's not going to work in practice. I know what it's like with the nurses. They're never going to do that. And they're not going to do, it's not going to be practical for them because I've got that real life clinical experience. So I think, that clinical academic role, having my clinical practice informing the research is so important, and which is why I love it. I think from my main takeaway really is like with everyone, it's be surrounded by people that love what they do. There's so many people that are brilliant in the society that give you support and encouragement, and, you collaborate and find people, if you're interested in doing tissue viability, go and talk to the tissue viability nurses where you work. You won't get many people that will turn around and be like, no, I don't want to talk to you. It's like, when you find people going, I'm interested in what you do, they'll love to talk about it. So, sometimes it's quite hard to put yourself out there, but yeah, make those first steps, go and talk to people, find a mentor. And there's so many options.
Thanks, Claire. That's brilliant. So we've heard from all of our speakers now. So we've got plenty of time now for some questions and discussion. I'd just like to kick off because I think pretty much all of you mentioned the importance of having someone who inspired you. And I just think about our roles at the moment, or people in a role, whether you're in tissue viability or not. I think we all have a responsibility to try and inspire, don't we? But it's tricky sometimes. I think clinical care can be disjointed. It's under pressure. Sometimes there's a disconnect between managers who, they do little clinical. I'm always hearing these complaints. So they're always in the office. They're not out in front of the patients. So who can, it can be tricky. Any little ideas, any hints and tips as how we can grab these people to be inspirational to us?
I think one of the issues, it's as you say, it's looking around to where mentors are, and I think sometimes people forget who can help. A big part of my role is coaching and mentoring, and that might be 1 minute. So today I've spent 2 hours doing a tutorial with somebody who's very new to tissue viability, and she doesn't really understand the speciality, and she's getting to grips with it. And then, another person who might be studying with us, and lots of our students stay in contact with us for years and years and years, it's sort of in an informal mentoring role, could be somebody who's actually been working for 25, 30 years. You know, they've got different issues, and sometimes you can find mentors who are related to your field, understand, come from your background, but are actually a step outside, and that can be very useful to help people, rather than sometimes it's difficult to talk about an issue within your sort of practice areas and your localities. So, you know, I think it's reaching out to people. I think I see a lot of practitioners who are just nervous at saying, actually, I'd like to chat about this, or can I run through this idea with you? People feel vulnerable and don't want to do that. So there's different areas where you can get mentorship and support from, and you know, most people are really happy to help and support. It's a key part of our roles. Yeah.
Absolutely. And I think you were saying, Claire, you know, about, you know, we are approachable. I think sometimes what I found is that when you go into a specialist role, there can be this air of sort of elitism. And that can be a barrier for people. They think, you know, we're not approachable. I had to work very hard with some people coming into my team that coming from a generalist role into a specialist role became a bit sort of I'm quite special, you know, I know it all. And I had to sort of really dampen that down to say, no, you know, we're here to support, we're equal. It's just that we've chosen a speciality. So that can be a problem sometimes, can't it? I don't know if any of you have had experiences like that or.
I mean, I was just going to say from the finding a mentor perspective, it's, you know, having a really good mentor, it meant so much to me. And I think that then means that, you know, I want to equally do that for other people, you know, and I think, you know, it's that kind of cycle of getting it together. But, you know, I think in a way we all have imposter syndrome, don't we? And I think sometimes, you know, people can be a bit overconfident, like what you were saying there, Sarah, and like thinking we know it all and, you know, better than others. But I think sometimes that might just be people overcompensating. But, you know, at the same time, some people will be there going, oh, I don't know if I'm suitable to be a mentor for anyone. I've only been doing this job for 2 years. But, you know, you've still got 2 years worth of experience that's more than someone else has got. So anyone, you know, can provide that help and support. You know, and I think, you know, you just got to sort of talk, or, you know, if people don't feel they're able to be able to help you, it's more likely they will know someone that will be able to, though. So you can just say, can you help me, or do you have anyone that you can put me in touch with?
Could I just pick up on that? I think that's a really interesting point about people feeling that I'm not good enough to do this. And in my world, what we need clinicians with your experience to come in and teach the other people who are themselves tissue viability or specialist nurses or even doctors who are studying this speciality. But we need your expertise to come in and teach. And it's very difficult to encourage people. If I say to you, oh, go and do a teaching session on the ward or a postgraduate centre in the hospital, people go, yeah, sure, no problem. If I say come to the university to do it, people go, oh, you know, I can't do that. And that's a barrier. And all of you out there need to recognize that it's your knowledge and skills. That's what we need. That's what keeps our programs, our teaching relevant and real life. And it gives you confidence. It helps you develop your specialist practice. And again, may link to improved networking, new mentors, or even new job opportunities. So it's about having confidence for all of us to step out. You know, it's the same with research, isn't it? People say, oh, you know, oh, I don't know anything about research. You know, it's starting with small activities, building up your confidence, and getting support from the researchers or the statisticians or the educators or the tissue viability nurses who've been doing it longer than you. We've all got something to offer. But I think in all of our stories, if we hadn't have just gone for it. And I think that's a real key theme, is just being brave on a particular day and say, yeah, I'll give that a go. And that's what got me where I am. I can see Paul and Luxmi and Claire all nodding. We never had a career pathway. There wasn't when I started, when Sarah started, there wasn't that pathway. It was just all a bit random. There is a career pathway now. So know what that is, know how to get into it, and know who you can talk to for help and advice. I think that's the key.
If I, sorry, Sarah,
no, please,
if I
Luxmi,
just
go
quickly
ahead.
add on that, and obviously I have been told by Madeline, I am where I am because of educators like Madeline. But as you know, Sarah, our tissue viability community is a very small family, and we love to grow our own. And if we didn't have mentors who grew us in that role of wound care specialism, none of us here today would be where we are today. And I know I speak for most of my community, my tissue viability colleagues, either in acute or community, either setting they work. 18 years of tissue viability, and I know most tissue viabilities still love to develop other nurses. So, you know, we welcome everybody with open arms. Come and shadow us, have a feel of what we do, see how we do things. And if that's for you, then you know you've made the right choice. But and I'm sure I'm speaking on behalf of all my tissue viability colleagues here. Sorry, thank you.
I'd like to bring up the subject of sort of education or academia versus experience, because we hear this, don't we? We have had a conversation recently with somebody that said that she just felt that it's not just about qualification, having to do a master's, you know, in tissue viability. Experience should account for something. She's absolutely right, but can I ask the panel's thoughts on that? I don't know who wants to start.
I don't mind starting with that. I think that's a really important question, and I think sometimes people think that you can just go and get a qualification, and you might get a phone call from someone. I'm not yet qualified. I'm qualifying in 6 months' time. Can I come and do your tissue viability degree? Now, all degrees have entry criteria, and most within a speciality will actually want experience first. You can't just come out of, you know, qualify with no experience, no clinical experience, and start immediately specializing. So you've got to work, you've got to understand your craft, you know what nursing is, or podiatry or pharmacy or whatever clinical background you are. And then you start to develop your interests. So most degree programs will actually insist on a certain amount of time, and that's absolutely vital, because qualifications are not they're not sort of testing. It's not a memory test, it's not a multiple choice test. These are skills acquisitions to do clinical roles, so you need to know what that's all about. So it's the two together, and I think certainly in this country, or the UK in general, we take a view that experience, and yes, you do need to have qualifications, and you basically need a master's degree to be a specialist practitioner in this country, but the two come together. In other countries, you can just do a test, and if you answer the wound care questions correctly, you will be classified as a specialist practitioner. So we don't take that view here, and I think that's very, very important.
Oh, thanks. Anybody else like to comment on that? Any other thoughts? No? Okay. We have got some questions actually in the chat here. Let me just scroll one. There's I think it was yes. There's somebody who is a nurse associate, and is there anything she can do to get as close she can to tissue viability, down the tissue viability route, or the wound specialism? So you don't say which area you're, or actually you've got a comment above. So you work currently specialising in complex wound care in a treatment room. So it sounds like you're in primary care. but she'd like to maybe go down the tissue viability route. I think we've probably covered quite a bit of that, but any other further advice for Casey? I know we talked about maybe getting the experience shadowing and things like that. Anything else that she can be doing?
Yeah, I think shadowing's a good one, like speaking to the tissue viability nurse. I mean, hopefully everyone should have like an appraisal every year and have that discussion, with your line manager. And, if you're sort of say as part of that, I would like to develop in tissue viability. You don't necessarily have to be saying I want to do a course or something. You mean that could be part of what you have on your appraisal and your plan, your progression plan. But it could just be to say, well, can I ask your manager, you don't ask, you don't get. Can I have a couple of days this year to go and shadow the tissue viability nurse? And then just sort of, if you give it to them as that you're going to bring something back, what I will learn, I will bring back to my practice. I will share it with my colleagues. I will do this. Then it kind of makes it hard for the managers to say no. I mean, they might still say no, but, it's kind of, you're turning it around to, this is what I want to do, but this is what it's going to bring back to the service, what it's going to bring back to the wound clinic. And, there's lots of things like, Luxmi's talked about being a link nurse. They're all the kind of things that you can do. Talk to the tissue viability nurses. Are there any particular projects that are going on that, have you got any ideas that you want to do? Like, looking at dressing formularies and, if you're there going, why are we using this dress and it's really expensive? It can start off with small things like that, of just reviewing what you're using in practice and doing a little literature review to sort of see if there's any evidence behind the different dressings out there. So there's lots of little things that can be done. But I think
with audit, you could help with audit. There's all sorts of practical help you can give, because TVNs are really busy. They've always got things that they'll help, be pleased for you to get involved in.
Yeah.
Any advice if you had an NA approach you, Paul, about sort of wanting to develop some more skills? Any advice that you would give?
I think the panel's pretty much covered a lot of it, but I think becoming like we've got a very, very good network of TV champions where I work, and a lot of it's a good mix of staff. So it's not just registered nurses. We've got trainee nursing associates, nursing associates. We've got apprentices. We've got healthcare assistants as well. So it's doing as much as you can do to get involved in that world, isn't it? So when opportunities do arise, then you can take full advantage of those. And as Madeline was saying, get involved in. I mean, we do as well as the ward assurance, which I'm sure Claire may do in her also. We do a TV audit every month as well. So it's getting involved. It's making your that passion known, isn't it? That you want to get involved with all that. But it is a frustrating road though as well, though, isn't it? Because if you've got a real passion for tissue viability, I mean, where I work, I mean, in these times of austerity, tissue viability positions, they don't come up very often, unfortunately. So it is that kind of dead man's shoes sometimes, isn't it? But that's not to stop individuals from trying to do as much as they can do so they can make themselves as appealing as possible when potential opportunities do come up, that they, when they're applying, they really stand out against everybody else, really, which is really, really key, isn't it? Because in these times, you've really got to stand out. I mean, it's what sets you apart from the rest of the crowd, isn't it? So doing as much as you can do to get involved, get your faces known, spend time with the TVNs in your trusts. It's as much as you can do, isn't it, really? So but yeah.
Actually, that brings me on really nicely, Paul, to a question on recruitment and interviewing, because my goodness, and I'm sure we've all been there, we've had people apply for jobs in tissue viability and they haven't even seen a wound, So hints and tips, panel, please, for preparing for an interview for a tissue viability post, how to make yourself desirable applicant. Who wants to go first? Luxmi.
Yes, and I can definitely obviously share my personal experience on that. And as a Band 5 who applied for a tissue viability post, I already had some academic modules at level 6 in wound care when I applied for that job. So that put me in a really strong position, because theory, I knew my wounds, but I was also putting it in practice. So when you do go for an interview, just make sure you're not just doing it to get the specialist title. know your wounds, know why you want it, and make sure you're really keen to learn, because tissue viability is forever learning. No wounds is the same, no two patients are the same. And up to now, and I'm so grateful we got a good cohort of tissue viability that I still link up. I still share complex issues and, you know, seek for ideas or new ideas or different ideas. So when you're going for that interview, you need to be prepared to sell yourself as, yes, I know my wounds, I know why I'm here, I'm keen to develop, but also tell the panel what you're bringing with you, what change you're going to bring, what knowledge and skill you're bringing, and what are you expecting to gain or learn from the team that you'll be working. It's not a solo start, it's a team working approach, and you really need to be compassionate. So I think it's just getting that bit right.
Thank you. Anyone else want to?
I would just add, I'd take it a step back further. So I agree with everything that's been said, but I think the first thing you need to do is look at the role, look at the trust, look at the specialities. So you're mapping out and thinking, what are the tissue viability issues here? So that we've said it's a unique speciality. Wounds are everywhere, from prison services to psychiatric to maternity. So have a look. Is this a district general hospital? Is it a community? You know what's there. Talk to the team. It's amazing how many times you say, come and have a informal chat with the team. And people don't do that because I think they're nervous to do it. So what size is the team? Where are the gaps? Ask people what it's like working in the team. You might decide not to go for the interview, actually. And that's not a bad thing either. But unless you know what types of wounds and problems and issues are likely to be out there, you're not actually demonstrating that you've done your homework and you've found out about the surface. So that will give you certainly plenty to talk about in your interview. I think sometimes people think it's all about them talking about you and your skills. It's also, as Luxmi said, it's about you saying, hey, I'm scoping out your practice and your issues, and this is where I could be of help and add value. And that will always stand you. Anyone who's prepared, comes prepared, you'll always get shortlisted. You'll always get to the next round.
Yeah, I'd completely agree with that. Go and talk to the person that's put the job out. I'm amazed now recently, the last few times we've had a job going out, we've had people, no one's come and inquired about it or talked to us about it. They put applications in, but they don't talk. And it's like, well, actually, put yourself out there, go and talk to the team. And then actually when they see your application, when they see you coming to interview, oh yeah, I remember Paul, he was really friendly. He was really interested in that stuff. And then, actually it sort of puts you in a better stead at the beginning. And I think my biggest message, I think, for today is put yourself out there, go and talk to people in all these situations.
I was going to say as well, probably think about transferable skills as well. So if you've done things like improvement work, or you're interested in governance or patient safety or any of those kind of things, then it's bringing that in as well. Because as I said, as a TVN, you're involved in so many facets of nursing, aren't you? It's not just by the bed dealing with that complex wound right in front of you. It's if it was a pressure, also the reviews of care that may follow of that, the improvement work that's going to follow that, facilitating all those groups of people to do that improvement work. And then, feeding back about it, sharing it with the wider organisation, so you've got to be good at communicating with the whole organisation and things like that. So it's about those transferable skills as well, which we find, people don't talk about enough either as well. And as everybody else has said, they don't come and talk to us anyway, but, it's about those other things to think about as well.
Thank you. Really, just finally, I've just seen a comment really, and partly a question in the Q&A. And it's from a newly qualified nurse who developed interest in tissue viability in her second year as training, but due to job shortages but she's applied for and successfully got in for a postgrad certificate in advanced wound care. She's had mixed views from people about the course. Do you think it's a good idea or a route? Moreover, people are saying that she's too young to specialise at 21. And I should go and work on a ward for a while. Just as a final thoughts, folks, before we close?
Well, I think if you've taken that opportunity and got on something, you just need to keep you get those clinical skills as well. So, you haven't got many years experience in clinical skills and can't hide that. But my whole career, people told me that I was doing things too early, and eventually you'll catch up with yourself. So you need to balance and make sure that your education matches your clinical skills. Don't keep collecting qualifications. That's what some people do. They go jumping ahead and they've got no practical skills at all. So you're no good in the workforce. But I think it's sometimes about talking to people in education about the way forward and making sure you're on the right type of course, what type of modules are you doing, what type of degree course, and getting the right advice early on so that you can plan ahead. Because I think a lot of the time people are given the wrong advice and they can make mistakes. So I think it's a balance, but I think, if you've got ahead and got onto something, then you need to turn it to your advantage and catch up with your clinical skills.
And I'm sure we're all delighted that someone is interested in this speciality
exactly.
at such an early age. I'm probably going to have to, we're just going to end the webinar just with a sort of post-webinar Slido poll again. So Kerry, are you able just to launch that for us, please?
I am. So smartphones at the ready, everybody, and just bear with me while I share.
And just to say that there was a comment also about how people can get in touch with us if they have questions about career development.
Yes.
If you just go into the website of our website, there's a sort of help support email. Do drop an email and we can then, point you in the right direction, I'm sure.
Mm-hmm. Could I just add something? It's a little bit of an advertisement for something we're doing within the society. We are currently looking to update a list of educational courses and qualifications available across HE in the UK, and that's quite complicated. It's taking us a bit longer than we thought it would, but in the new year we should certainly have that information available. So what I would say is join the Tissue Viability Society, keep in touch with us, keep looking on the website, because it's through that networking where you'll see, hopefully this list that we can get up, and it's hard to keep it up to date, but there's some questions in the chat saying where can I go for this sort of course. You need to look carefully and you need to ask questions of the course leader to make sure you're on the right thing. But hopefully we'll have some information early in the new year on that.
And can I also add, I know there's some fantastic work going on out there. So, when you want to sort of get yourself known or get your work out there, sometimes just by submitting a poster, an abstract for a poster at our conference, for example, next year, we'd love to see you there. But that sort of it just inspires you when you see your work on a poster. But also, I know there's some fantastic work going on generally, and the next year we've also running our awards as well. So please share what you've been doing, and you never know, you could be chosen in one of our award winners. So hopefully we'll see you at conference next year, 22nd and 23rd of April in Bradford again. I want to thank the panel today. It's been a really interesting discussion, and hopefully we've given people food for thought about where they're going, in which direction with their career pathway. And we hope to see you as one of that, that are our community as we move forward through the years.